When people reach the age of 70 and beyond, the body naturally becomes more vulnerable to chronic diseases and age-related health problems. This does not mean that life after 70 must be filled with illness, but it does mean that awareness, prevention, and timely medical care are essential. Many studies show that older adults often experience multiple conditions at the same time. Understanding the most common diseases after 70 allows seniors and their families to be more proactive, to maintain independence, and to enjoy a longer and healthier life. In this video, we're going to explore 24 of the most common diseases that affect people after 70. For each one, we will talk about what the disease is, why it happens more often in older adults, common warning signs, and what you can do to reduce the risks. By the end, you will have a clear roadmap for protecting health in later years. Let's begin with the first group, cardiovascular diseases. These conditions are some of the most widespread causes of illness and mortality in seniors. 1. Coronary artery disease. Coronary artery disease, also called ischemic heart disease, occurs when the blood vessels supplying the heart become narrowed or blocked by fatty deposits called plaques. This reduces blood flow to the heart muscle. After age 70, the risk of coronary artery disease increases significantly because arteries have been exposed to decades of high blood pressure, high cholesterol, diabetes, and sometimes smoking. The walls of the arteries become less flexible, making blockages more likely. Typical warning signs include chest pain or pressure, shortness of breath, fatigue, or discomfort in the arms, neck, jaw, or stomach. However, in older adults, symptoms can sometimes be unusual. Instead of strong chest pain, they may only feel weakness, confusion, or dizziness. That is why it is critical never to ignore new or unexplained symptoms. Prevention includes controlling blood pressure and cholesterol, eating a balanced diet rich in vegetables, fruits, and lean proteins, staying physically active, and avoiding tobacco. Seniors should also have regular checkups with a doctor who can monitor heart health and adjust treatment if necessary. 2. Heart failure. Heart failure does not mean that the heart has completely stopped working. It means that the heart is too weak or too stiff to pump blood efficiently. This causes fluid to build up in the lungs, legs, and other parts of the body. Among people over 70, heart failure is very common because many have already lived with high blood pressure, coronary artery disease, or previous heart attacks, which weaken the heart over time. The most common symptoms include shortness of breath during simple activities, swelling in the feet or ankles, fatigue, sudden weight gain from fluid retention, and waking up at night feeling breathless. Managing heart failure requires a combination of lifestyle and medical care. Seniors are often advised to reduce salt intake, monitor weight daily, follow prescribed medications, and stay physically active with light, doctor-approved exercises. Early recognition is key because treating heart failure in its early stages can slow its progression and greatly improve quality of life.
3. Hypertension. High blood pressure. High blood pressure, also called hypertension, is one of the most common conditions in people over 70. It happens when the force of blood pushing against the walls of the arteries stays consistently high. Over time, this puts strain on the heart, kidneys, eyes, and blood vessels throughout the body. Why does hypertension become more common after 70? As we age, our arteries naturally stiffen and lose flexibility. This makes it harder for blood to flow smoothly, which raises pressure. In addition, decades of lifestyle habits, such as a high-salt diet, lack of exercise, stress, or smoking, can all contribute. The challenge is that high blood pressure is often called the silent killer. Many seniors have no obvious symptoms until complications appear, such as stroke, heart attack, or kidney damage. Some may feel headaches, dizziness, or blurred vision, but these signs are not reliable. That is why regular blood pressure checks are critical after age 70. Controlling blood pressure usually requires a combination of lifestyle and medical treatment. Doctors often recommend a low-sodium diet, plenty of fruits and vegetables, maintaining a healthy weight, exercising regularly, limiting alcohol, and quitting smoking. If lifestyle changes are not enough, medication may be prescribed to keep blood pressure within safe limits. Consistent management helps prevent serious complications and allows seniors to live more independently. 4. Stroke. Stroke is another major health risk after 70. It occurs when blood flow to part of the brain is blocked, or when a blood vessel in the brain bursts, leading to brain damage. Older adults are particularly vulnerable because age itself is one of the strongest risk factors. Strokes can be devastating, but they can also be treatable if recognized quickly. Symptoms often include sudden weakness or numbness on one side of the body, difficulty speaking or understanding words, sudden vision problems, dizziness, or loss of balance. Sometimes strokes occur silently with only subtle changes in memory or movement, which families may overlook. After 70, strokes often result from long-standing hypertension, atrial fibrillation, diabetes, or atherosclerosis. Prevention focuses on controlling these risk factors. Seniors should monitor blood pressure, keep blood sugar levels stable, avoid smoking, eat a balanced diet, and stay physically active. For those with atrial fibrillation, blood-thinning medications may be prescribed to reduce the chance of clots traveling to the brain. Acting fast is critical. The well-known rule is, time is brain. If a stroke is suspected, emergency care must be sought immediately. Early treatment can save brain cells and prevent long-term disability. Families should learn to recognize the warning signs quickly so that seniors have the best chance of recovery. 5. Atrial fibrillation. Atrial fibrillation, often shortened to AFib, is a type of irregular heartbeat that becomes far more common after 70. In this condition, the upper chambers of the heart beat in a chaotic rhythm, causing blood to pool instead of flowing smoothly. This increases the risk of dangerous blood clots forming. The greatest danger of atrial fibrillation is stroke. A clot that forms in the heart can travel to the brain and block blood flow, leading to a major stroke. For this reason, AFib is one of the most important heart conditions to detect and treat in seniors. Symptoms may include palpitations, a racing heartbeat, shortness of breath, weakness, or fatigue. However, some older adults feel no symptoms at all, and the irregular rhythm is only discovered during a routine checkup. Treatment usually involves medications to control heart rhythm, slow the heart rate, and prevent clots with anticoagulant drugs. Lifestyle changes such as reducing caffeine and alcohol, maintaining a healthy weight, and staying physically active are also helpful. For some patients, special procedures may be used to restore normal rhythm. The key message is that seniors over 70 should have regular heart checkups because detecting atrial fibrillation early can prevent a life-threatening stroke and greatly improve life expectancy. 6. Peripheral artery disease. Peripheral artery disease, or PAD, occurs when arteries in the legs and arms become narrowed or blocked due to plaque buildup. It is essentially the same process as coronary artery disease, but it affects blood flow to the limbs instead of the heart. After 70, PAD is common because arteries have been exposed to decades of wear and tear, especially in people with a history of smoking, high blood pressure, diabetes, or high cholesterol. Reduced blood flow to the legs causes muscle pain or cramping when walking, known as claudication. The pain usually improves with rest, but returns with activity. Seniors may also notice slow healing wounds on their legs or feet, or the skin may appear pale or bluish. Peripheral artery disease is not just a problem of the legs. It signals widespread atherosclerosis in the body, which also raises the risk of heart attack and stroke. This is why detecting PAD is so important. Prevention and treatment focus on improving circulation, quitting smoking, regular walking exercises, controlling diabetes and blood pressure, and medications to thin the blood or lower cholesterol are common strategies. In severe cases, procedures may be needed to open or bypass blocked arteries. With early recognition and care, seniors can maintain mobility and independence for much longer.
7. Chronic obstructive pulmonary disease, COPD. Chronic obstructive pulmonary disease is a long-term condition that makes breathing difficult. It includes chronic bronchitis and emphysema, which both damage the airways and lungs. After 70, COPD is common in people who have smoked for many years, but it can also occur in non-smokers exposed to air pollution or secondhand smoke. The main problem in COPD is that airflow becomes blocked and the lungs lose elasticity. Seniors with COPD often struggle with chronic cough, wheezing, and shortness of breath, even during simple activities like walking or climbing stairs. Over time, low oxygen levels may cause fatigue, weight loss, or even confusion. Because COPD progresses slowly, many people underestimate it until daily activities become extremely difficult. Prevention begins early in life with avoiding smoking. But even after 70, quitting smoking can still slow disease progression. Vaccinations against flu and pneumonia are strongly recommended for seniors, since these infections often go hand in hand. Good hand hygiene, avoiding contact with sick people, and managing chronic conditions all lower the risk. For those who do get pneumonia, prompt medical treatment with antibiotics or antiviral drugs, along with supportive care such as oxygen and hydration, can save lives. Families should never ignore sudden changes in breathing, alertness, or overall strength in an elderly person. 8. Pneumonia. Pneumonia is an infection that inflames the air sacs in the lungs, causing them to fill with fluid or pus. For people over 70, pneumonia is especially dangerous because the immune system is weaker and the lungs may already be affected by other conditions like COPD or heart disease. Symptoms include cough with phlegm, fever, chills, chest pain, shortness of breath, and confusion. In seniors, confusion or sudden weakness may be the only noticeable signs, making diagnosis harder. Pneumonia can be caused by bacteria, viruses, or fungi. The bacterial form, often due to Streptococcus pneumoniae, is one of the leading causes of hospitalization and death among older adults. Prevention is possible. Vaccines against pneumonia and influenza are strongly recommended for seniors, since these infections often go hand in hand. Good hand hygiene, avoiding contact with sick people, and managing chronic conditions all lower the risk. For those who do get pneumonia, prompt medical treatment with antibiotics or antiviral drugs, along with supportive care such as oxygen and hydration, can save lives. Families should never ignore sudden changes in breathing, alertness, or overall strength in an elderly person. 9. Influenza and respiratory infections. Influenza, or the flu, is often thought of as a simple seasonal illness, but after age 70, it can be life-threatening. The flu can trigger complications such as pneumonia, dehydration, or worsening of chronic diseases like diabetes, COPD, or heart failure. In seniors, flu symptoms may look slightly different. Instead of high fever and strong cough, an older adult may just feel weak, confused, or have a poor appetite. This makes it easy for the flu to be mistaken for another condition, delaying treatment. Other respiratory infections such as respiratory syncytial virus, or RSV, or COVID-19 also hit older adults much harder. Prevention is the most powerful tool. Annual flu vaccination significantly lowers the risk of severe illness. In fact, vaccines may not prevent all infections, but they greatly reduce the chances of hospitalization or death. Seniors should also keep up to date with COVID-19 vaccines and boosters, as well as RSV vaccines if recommended by their doctor. Simple habits like frequent hand washing, wearing a mask in crowded places during flu season, and maintaining good ventilation indoors are also effective.
When infection does occur, early medical care is essential. Antiviral medications can reduce the severity of the flu if started within the first 48 hours of symptoms. Families should be alert to sudden weakness, breathing difficulty, or confusion in elderly relatives, since these can be signs that a respiratory infection is becoming dangerous.
10. Type 2 diabetes. Type 2 diabetes is one of the most widespread chronic diseases among people over 70. It occurs when the body becomes resistant to insulin or does not produce enough insulin to keep blood sugar levels normal. Over many years, high blood sugar damages blood vessels, nerves, kidneys, eyes, and the heart. Why is type 2 diabetes so common after 70? First, aging itself reduces the body's ability to regulate blood sugar. Muscle mass decreases, fat tends to accumulate in the abdominal area, and metabolism slows down. Second, many older adults have lived with risk factors for decades, such as overweight, lack of exercise, high blood pressure, or an unhealthy diet. Some seniors may have developed diabetes earlier in life, while others only discover it in their 70s. The challenge is that symptoms of diabetes can be subtle in older adults. Instead of the classic signs like excessive thirst and frequent urination, seniors may only feel tired, lose weight without explanation, or develop infections that heal slowly. Numbness in the feet, vision changes, or confusion may also appear. Sometimes diabetes is not detected until complications such as stroke, heart disease, or kidney problems have already developed. Managing diabetes after 70 requires careful balance. Diet plays a central role. Seniors are advised to eat smaller, more frequent meals with high fiber, lean proteins, and limited refined sugars. Exercise, such as walking or light resistance training, improves insulin sensitivity and keeps weight under control. Regular blood sugar monitoring is important, but older adults may need help from caregivers if vision or dexterity is limited. Medications are often prescribed, but treatment must be personalized. Some drugs can cause low blood sugar, which is dangerous for seniors because it may lead to falls, confusion, or even loss of consciousness. Doctors usually aim for safe, not overly strict blood sugar targets to reduce risk while still protecting long-term health. Prevention of complications is just as important as controlling blood sugar itself. This means regular eye exams to check for diabetic retinopathy, foot care to avoid ulcers, kidney function tests, and cardiovascular screening. With proper management, even seniors diagnosed at 70 or later can live actively and reduce the risk of serious problems.
11. Osteoarthritis. Osteoarthritis is the most common joint disease among seniors, and it becomes especially widespread after the age of 70. It occurs when the protective cartilage that cushions the ends of bones wears down over time. Without this smooth cushion, bones rub against each other, leading to pain, stiffness, swelling, and reduced mobility. For older adults, osteoarthritis often affects the knees, hips, hands, and spine. The pain can make it difficult to walk, climb stairs, or even perform simple daily tasks like opening jars. Morning stiffness that improves with movement is another hallmark symptom. The condition is caused by decades of wear and tear on joints, but factors like obesity, previous injuries, genetics, and repetitive use of certain joints all increase the risk. Management focuses on pain relief and preserving mobility. Regular low-impact exercises, such as swimming, walking, or Tai Chi, help keep joints flexible and muscles strong. Weight management reduces pressure on weight-bearing joints. Physical therapy teaches safe movements and builds muscle support. Medications like pain relievers or anti-inflammatory drugs may be recommended, and in severe cases, joint replacement surgery can restore function. Osteoarthritis is not curable, but with proper management, seniors can maintain independence and continue enjoying daily activities. 12. Osteoporosis. Osteoporosis is a condition where bones become weak and brittle, making them more likely to break. After age 70, the risk of osteoporosis rises sharply, especially in women after menopause, but also in men. The silent nature of osteoporosis makes it particularly dangerous because bones can weaken without any symptoms until a fracture occurs. The most common fractures in older adults are of the hip, spine, and wrist. A hip fracture often leads to hospitalization, surgery, and loss of independence, while spinal fractures can cause chronic pain, height loss, or a hunched posture. Contributing factors include lower levels of hormones like estrogen and testosterone, lack of calcium and vitamin D, physical inactivity, smoking, excessive alcohol, and certain medications such as steroids. Prevention and treatment rely on building and maintaining bone strength. Seniors should ensure adequate calcium and vitamin D intake, either from diet or supplements. Weight-bearing exercises such as walking or light strength training help stimulate bone formation. Medications that slow bone loss or promote bone growth may also be prescribed. Bone density scans are important for early detection, especially for women after menopause and anyone with a family history of fractures. 13. Sarcopenia, age-related muscle loss. Sarcopenia is the progressive loss of muscle mass and strength that occurs with aging. After 70, it becomes one of the leading causes of frailty and loss of independence. Unlike normal aging, sarcopenia is more severe and results in weakness, slower walking speed, and difficulty performing everyday tasks. Why does sarcopenia happen? Muscle tissue naturally declines with age, but inactivity, poor nutrition, and chronic diseases accelerate the process. Low protein intake, hormonal changes, and inflammation also play a role. The consequences are serious. Sarcopenia increases the risk of falls, fractures, hospitalization, and even mortality. Seniors with sarcopenia often lose confidence, withdraw from social activities, and become more dependent on caregivers. Prevention and treatment involve exercise and nutrition. Resistance training, even with light weights or body weight exercises, is the most effective way to build muscle strength at any age. A diet rich in high-quality protein, such as lean meat, fish, eggs, beans, or dairy, supports muscle repair. Vitamin D supplementation may also help. Doctors sometimes prescribe physical therapy to design safe and effective exercise programs tailored to seniors. 14. Falls and fractures. Falls are not a disease, but they are one of the most serious health risks for people over 70. Falls can lead to fractures, head injuries, and long hospital stays. In fact, falls are a leading cause of disability and loss of independence among older adults worldwide. Why do seniors fall more often? The reasons include weak muscles from sarcopenia, fragile bones from osteoporosis, balance problems, poor vision, certain medications that cause dizziness, and unsafe home environments. Even something as simple as a loose rug, poor lighting, or a slippery bathroom floor can lead to a dangerous fall. The consequences of falls can be life-changing. A hip fracture often requires surgery and months of rehabilitation. Some seniors never regain their previous level of mobility and independence. Fear of falling again can also cause anxiety, depression, and reduced physical activity, which further increases weakness and the chance of future falls. Prevention strategies are highly effective. Seniors should stay active with balance and strength exercises such as Tai Chi or yoga. Regular eye exams and proper footwear improve stability. Homes should be made safer with grab bars in the bathroom, non-slip mats, and good lighting. Medications should be reviewed by a doctor to minimize side effects that increase fall risk. With the right measures, many falls can be prevented, both protecting health and independence.
15. Alzheimer's disease and dementia. Alzheimer's disease is the most common form of dementia, a group of conditions that cause a progressive decline in memory, reasoning, and thinking skills. After the age of 70, the risk of Alzheimer's rises sharply, and it becomes one of the most feared diseases among seniors and their families.
In Alzheimer's, abnormal protein deposits accumulate in the brain, disrupting communication between nerve cells and eventually causing brain cells to die. The earliest signs are often subtle, forgetting recent events, misplacing items, or struggling to find the right words. Over time, the disease progresses to more serious problems such as confusion about time and place, difficulty recognizing loved ones, personality changes, and inability to perform basic daily activities. The exact cause is not fully understood, but aging, genetics, cardiovascular risk factors, and lifestyle all play a role. While there is no cure yet, medications may help slow symptoms for some patients, and non-drug strategies, such as mental stimulation, physical activity, and structured routines, can improve quality of life. For families, caregiving becomes increasingly demanding as the disease progresses. Support groups, respite care, and early planning for legal and financial matters are critical. Recognizing dementia early allows families to create a care plan that preserves dignity and independence for as long as possible. 16. Parkinson's disease. Parkinson's disease is a progressive neurological disorder that affects movement. It usually develops after age 60, but its impact becomes most noticeable after 70. Parkinson's occurs when nerve cells in the brain that produce dopamine, a chemical essential for smooth movement, gradually die off. The hallmark symptoms include tremors in the hands, stiffness, slowness of movement, and problems with balance. Over time, speech may become softer, handwriting smaller, and facial expressions less animated. In later stages, non-motor symptoms such as sleep problems, depression, constipation, and cognitive changes often appear. Although Parkinson's is not curable, treatment can significantly improve quality of life. Medications like levodopa help replace dopamine and reduce motor symptoms. Physical therapy, occupational therapy, and regular exercise are vital for maintaining strength and mobility. Some patients may benefit from advanced treatments like deep brain stimulation. For seniors over 70, living with Parkinson's requires a supportive environment. Simple adaptations at home, such as grab bars, wide pathways, and non-slip flooring, can reduce falls. Family involvement and community support make a major difference in maintaining independence. 17. Mini-strokes, transient ischemic attacks, or TIAs. A transient ischemic attack, often called a mini-stroke, happens when blood flow to the brain is briefly blocked. Symptoms are similar to a stroke: sudden weakness on one side, slurred speech, or loss of vision, but they last only minutes to hours and then disappear completely. After 70, TIAs are warning signs of major strokes to come. They should never be ignored. About 1/3 of people who experience a TIA will later suffer a full stroke, often within weeks or months. The causes of TIAs are the same as strokes: high blood pressure, diabetes, high cholesterol, atrial fibrillation, and atherosclerosis. Preventing TIAs means controlling these risk factors. Doctors may prescribe blood thinners, cholesterol-lowering drugs, or recommend lifestyle changes such as diet improvement, regular physical activity, and quitting smoking. The critical message is that even if symptoms vanish quickly, medical evaluation is urgent. Seniors and caregivers should treat a TIA as an emergency because it provides a chance to prevent a devastating stroke. 18. Depression and anxiety in older adults. Mental health is often overlooked in seniors, but depression and anxiety are surprisingly common after 70. These conditions are not simply a normal part of aging, they are serious medical problems that can greatly affect quality of life. Depression in older adults may look different than in younger people. Instead of sadness, seniors may show irritability, loss of interest in activities, changes in sleep or appetite, low energy, or unexplained aches and pains. Anxiety often appears as constant worry, restlessness, or physical symptoms like rapid heartbeat and stomach discomfort. Risk factors include chronic illness, loss of a spouse or friends, reduced independence, financial stress, and social isolation. Left untreated, depression increases the risk of physical decline, disability, and even suicide in older adults. Treatment is effective and includes counseling, medication when appropriate, social support, and lifestyle measures such as exercise and meaningful activities. Encouraging seniors to stay socially connected, engage in hobbies, and maintain a daily routine is very helpful. Families and caregivers should watch for warning signs and seek professional help early, since recovery is possible at any age.
19. Vision loss, cataracts, glaucoma, and age-related macular degeneration. After 70, vision problems are among the most common challenges faced by seniors. 3 major conditions dominate: cataracts, glaucoma, and age-related macular degeneration. Cataracts occur when the normally clear lens of the eye becomes cloudy, causing blurred vision, faded colors, glare sensitivity, and difficulty seeing at night. Cataracts progress slowly, but by age 80, more than half of people either have cataracts or have had surgery to remove them. Fortunately, cataract surgery is safe and highly effective, restoring clear vision for most seniors. Glaucoma is a group of eye diseases that damage the optic nerve, often due to increased pressure inside the eye. It develops silently, with gradual loss of peripheral vision that may go unnoticed until significant damage has occurred. Without treatment, glaucoma can lead to irreversible blindness. Regular eye exams are crucial for early detection. Age-related macular degeneration, or AMD, damages the macula, the part of the retina responsible for central vision. This makes reading, recognizing faces, and driving extremely difficult. AMD is one of the leading causes of blindness in older adults. While there is no complete cure, certain treatments and lifestyle changes can slow progression, such as stopping smoking, maintaining a healthy blood pressure, and taking prescribed supplements. The key message is that vision loss is not an inevitable part of aging. With routine eye exams, timely surgery or treatment, and good lifestyle habits, many seniors can preserve their vision and maintain independence. 20. Hearing loss. Hearing loss, or presbycusis, is another very common condition after age 70. It usually develops gradually and affects both ears. Seniors often struggle to hear high-pitched sounds, follow conversations in noisy environments, or may frequently ask others to repeat themselves. Hearing loss may seem like a minor inconvenience, but it has far-reaching effects. It can lead to social isolation, frustration, depression, and even cognitive decline. Studies have shown a strong link between untreated hearing loss and increased risk of dementia. Causes include age-related changes in the inner ear, long-term exposure to loud noises, and sometimes chronic diseases such as diabetes or cardiovascular problems. Fortunately, help is available. Hearing aids are more advanced and discreet than ever before, allowing seniors to participate in conversations and enjoy daily activities again. In some cases, cochlear implants may be recommended for severe loss. Simple strategies such as reducing background noise, facing the person who is speaking, and using subtitles when watching TV also make communication easier. By treating hearing loss promptly, seniors not only improve their quality of life, but also protect their mental and emotional health. 21. Sleep disorders. Sleep problems are very common among seniors over 70. While many people assume poor sleep is a normal part of aging, chronic sleep disorders can significantly harm health and should not be ignored. Common issues include insomnia, restless leg syndrome, sleep apnea, and frequent waking during the night. Sleep apnea is especially dangerous. It occurs when breathing repeatedly stops and starts during sleep, leading to poor oxygen levels, loud snoring, and daytime fatigue. Left untreated, Sleep apnea increases the risk of high blood pressure, heart disease, and stroke. Why do sleep problems increase with age? Hormonal changes, medical conditions, medications, and reduced physical activity all play a role. Seniors may also nap more during the day, which disrupts nighttime sleep. Good sleep hygiene can make a big difference. Seniors should maintain a regular bedtime, avoid caffeine or alcohol late in the day, keep the bedroom dark and quiet, and engage in calming routines before bed. For those with sleep apnea, continuous positive airway pressure therapy can be life-changing. Quality sleep is not just about rest, it is essential for memory, mood, immune function, and overall longevity. Addressing sleep disorders early helps seniors stay sharp, active, and independent.
22. Chronic kidney disease. Chronic kidney disease, often called CKD, becomes more common after 70 because the kidneys naturally lose some filtering ability with age. When combined with conditions like diabetes, hypertension, and heart disease, this decline can progress into significant kidney damage. The kidneys are responsible for filtering waste products from the blood, regulating fluid balance, and maintaining essential minerals. In CKD, these functions gradually weaken. Symptoms may include swelling in the legs, fatigue, changes in urination, and loss of appetite. But in early stages, there may be no signs at all. Many seniors do not realize they have kidney disease until it is advanced. Uncontrolled CKD increases the risk of heart disease, anemia, weak bones, and eventually kidney failure, which may require dialysis or transplantation. Prevention and management include controlling blood pressure and blood sugar, avoiding excessive salt, staying hydrated, and having regular blood and urine tests to monitor kidney function. Some medications, such as certain pain relievers, can damage kidneys if overused, so seniors should always consult a doctor before long-term use. By catching kidney disease early, seniors can slow its progression and protect overall health. 23. Urinary tract infections. Urinary tract infections, or UTIs, are very common among older adults, especially women, but men are also affected as they age. After 70, several factors increase the risk: a weaker immune system, incomplete bladder emptying, enlarged prostate in men, or use of catheters in some patients. Symptoms may include burning during urination, frequent urges to urinate, cloudy urine, or lower abdominal pain. However, in seniors, UTIs often present in unusual ways. Instead of typical pain, they may cause confusion, agitation, or sudden changes in behavior. This makes UTIs easy to miss or mistake for dementia. UTIs can spread to the kidneys if untreated, leading to serious illness. Prevention strategies include staying well hydrated, practicing good hygiene, and urinating regularly instead of holding it in. Women may benefit from topical estrogen therapy, which helps maintain urinary tract health after menopause. Treatment usually involves antibiotics, but it is important to use the correct type and duration prescribed by a doctor. Seniors and caregivers should be alert to sudden changes in mood, awareness, or physical condition, since these may signal an underlying UTI. 24. Skin cancers and other skin problems. The skin is the body's largest organ, and after 70, it becomes thinner, drier, and less able to repair itself. This makes older adults more vulnerable to skin problems, including infections, pressure sores, and cancers. Skin cancer is the most serious concern. Years of accumulated sun exposure damage skin cells, and after decades, this damage may develop into basal cell carcinoma, squamous cell carcinoma, or melanoma. Warning signs include new growths, sores that do not heal, or changes in existing moles. Melanoma in particular can spread quickly and be life-threatening if not caught early. Other common skin issues in seniors include dryness, itching, easy bruising, and slow wound healing. Bedridden patients are especially at risk for pressure ulcers, also known as bed sores, which can become infected and difficult to treat. Prevention is straightforward but vital. Seniors should protect their skin from excessive sun with hats, clothing, and sunscreen even in later life. Regular skin checks, both self-exams and by a dermatologist, are crucial for early detection of cancer. Good daily skin care with moisturizers, gentle soaps, and proper nutrition helps maintain healthy skin. For those at risk for pressure sores, frequent repositioning and use of special mattresses can prevent complications. Now we have explored 24 of the most common diseases after age 70. From heart disease and strokes to dementia, osteoporosis, infections, and skin cancers, the list may seem overwhelming. But the key message is this: many of these conditions can be prevented, delayed, or managed with the right lifestyle choices, regular medical care, and strong social support. Healthy aging is not about avoiding every disease, but about reducing risks, detecting problems early, and maintaining quality of life. Seniors who stay active, eat well, protect their vision and hearing, manage their medications wisely, and keep strong social connections are far more likely to live independently and happily. For families and caregivers, awareness is the most powerful tool. By learning the signs, encouraging regular checkups, and supporting healthy habits, you can make a real difference in the well-being of your loved ones after 70. Aging is inevitable, but decline is not. With knowledge, action, and care, life after 70 can still be vibrant, meaningful, and full of joy.